Healthcare associated infections or HAI. It was commonly referred to as nosocomial or hospital-acquired infections earlier. This is seen when a patient comes to the hospital or healthcare facility for receiving treatment for an unrelated illness and they develop a new infection which they have acquired from within the hospital. This topic is of importance as in recent years an increasing trend of healthcare associated infections are seen. Learning objectives, the definition of healthcare associated infections, the role of clinical microbiology laboratory in healthcare associated infection, the importance of setting up a hospital infection control committee, who should be the members of this committee and what are their roles and responsibilities. Definition of healthcare associated infections. It is an infection that occurs in patients in healthcare settings which was not found to be present or incubating at the time of the admission. The patient must have been admitted for reasons other than the infection which he or she now has, which suggests that the infection was acquired from the hospital following admission. The patient must have shown no signs of active or incubating infection, and these infections must have occurred beyond 48 hours after being admitted in the hospital or within 3 days after the patient was discharged from the hospital or within 30 days after surgery or within 3 months after surgery with prosthetic devices or implants such as cardiac pacemakers or knee or hip joint implants. There are 4 major healthcare associated infections. The first is catheter associated urinary tract infection, which accounts for 30 to 40% of all HAIs. It is a urinary tract infection seen in patients who have an indwelling urinary catheter or within 48 hours of the removal of this catheter. The next is surgical site infections. It is an infection of the surgical wound site manifesting with purulent discharge or abscess formation. The time period to consider this surgical site infection as a healthcare associated infection was already mentioned in the previous slide. Do you remember it? It is 30 days for all surgeries and within 90 days or 3 months for surgeries with prosthetic devices. The next HAI is ventilator-associated pneumonia. It is a respiratory tract infection seen in patients who are intubated and on mechanical ventilation. And the last is catheter-associated or catheter-related bloodstream infection, also known as central line-associated bloodstream infection. It is an infection of the bloodstream in patients with an indwelling vascular catheter, which may be a central or peripheral venous line or an arterial line. Now that we have seen the major types of healthcare associated infections, let us look at the important organisms that cause these infections. They are methicillin resistant Staphylococcus aureus or MRSA, vancomycin intermediate Staphylococcus aureus or VISA, vancomycin resistant Enterococcus VRE, multi-drug resistant Pseudomonas aeruginosa, multi-drug resistant Acinetobacter baumannii, multi-drug resistant Mycobacterium tuberculosis, ESBL or extended spectrum beta-lactamase producing bacteria, Clostridium difficile, Legionella species, and Aspergillus species. If we look at this list of organisms, one thing is very obvious. Almost all of the organisms are highly resistant, which means that routine antibiotics are ineffective against them. So what is the impact of antimicrobial resistance on healthcare associated infections? I described many of the organisms in the list on the previous slide using the term MDR or multi-drug resistance. What does it mean? MDR is the resistance to 3 or more classes of antimicrobial agents. not 3 individual drugs, but 3 classes which include many drugs. Now, this resistance can be innate or acquired. On performing antimicrobial susceptibility testing, these organisms will show unusual patterns of resistance to antibiotics. These organisms are associated with serious clinical disease, which can lead to increased morbidity and mortality. And they are particularly difficult to treat as most available antibiotics are ineffective. As you can see in the image, the antibiotic is scared and running away from the resistant organism instead of the organism being chased away by the antimicrobial agent. Coming to the key functions of a clinical microbiology laboratory in the context of healthcare associated infections. First is rapid communication. It is crucial and the basis of any good collaboration between microbiology laboratory and infection control. It includes prompt detection and reporting of results, particularly of patients in critical care like the medical ICU, surgical ICU, neonatal ICU, transplant unit, hematology unit, who are all more likely to develop a healthcare associated infection. The next is to participate in outbreak management. 5 to 10% of healthcare associated infections are known to occur in clusters or outbreak. An outbreak is an unusual increase in number more than what is expected in a defined time, place, and person. The clinical microbiology laboratory helps in early isolation of a new or unusual pathogen, in reporting the cluster of infections which may be noticed in the laboratory when two related or similar organisms are isolated from different patients within the same time period. Next, the isolated organism must be identified up to species level and typed so that they may be compared better and identical organisms can be detected, which would indicate that there is an outbreak in the healthcare facility. Routine surveillance by microbiological testing of blood products, of environmental surfaces and air in critical areas like the operation theaters, ICUs, transplant ward, dialysis ward, and hematology wards. Testing of water supply to the hospital, both for general and drinking purposes. Testing of disinfectants and antiseptics to know if they are effective. Testing of the hands and nostrils of healthcare professionals, commonly to look for MRSA or methicillin-resistant Staph aureus. The third key function is accurate speciation and typing of isolated pathogens for epidemiological analysis of small clusters, in outbreak management as mentioned earlier, and for opportunistic pathogens. The last is to participate in antimicrobial resistance surveillance, which would help formulate policies for antibiotic use with the ultimate goal to decrease resistance within the hospital. In identifying emerging patterns of antimicrobial resistance, when organisms which were previously susceptible to a particular drug are now increasingly resistant to the same drug. To assess the effectiveness of precautions recommended to limit transmission by the Hospital Infection Control Committee. And finally, the microbiologist will be a member of the Infection Control Committee or team and the Antibiotic Committee. Next, we will briefly discuss about Infection Control Committee or ICC. Now, it has become the norm for all healthcare facilities to have a Hospital Infection Control Committee. It is a multidisciplinary committee which is responsible for monitoring program policies, implementation, and recommending corrective actions. It establishes standards for patient care. It reviews and assesses infection control reports and identifies the areas of intervention. It is made up of representatives from different concerned hospital departments and management. The Infection Control Committee, as a minimum, must include the hospital administrator, like the medical superintendent, an infection control doctor or the hospital microbiologist, infection control nurse. The number of nurses depend on the size of the healthcare facility and the availability of staff. An infectious disease physician, if available, the Director of Nursing, a representative from the major clinical specialties such as medicine, surgery, pediatrics, the in charges of the different ICUs, transplant units, etc. Additionally, representatives of other departments such as pharmacy, central supply, maintenance, housekeeping, etc. may be invited. The responsibilities of Infection Control Committee are to review and approve the annual plan for infection control and infection control policies for the facility, to direct resources to address problems that have been identified, to ensure availability of appropriate supplies like personal protective equipment in all necessary areas, to review epidemiological surveillance data and identify areas for intervention if any, to assess and promote improved practice at all levels of the healthcare facility, to ensure appropriate training in infection control and safety for all the staff of the facility, to review risks associated with any new technology or new devices prior to their approval for use within the facility, and to review and participate in outbreak investigations. So that brings us to the end of this session. To summarize, we discussed what is a HAI or healthcare associated infection. We went through its definition, the time periods that define it, the major types of HAIs, and the common organisms causing them. Next, we looked at the role of a clinical microbiology laboratory, which are rapid communication, outbreak investigation, species identification and typing, surveillance, both environmental and antimicrobial resistance. Then we discussed about the Infection Control Committee, who are the members that form it, and their functions. Thank you.